All right, Amelia, we're just wrapping up your oral exam here today. And I've noticed a couple of things here that I want to discuss with you. One is your gums are receding a bit. So are you aware of that at all?
Yeah, my teeth are, I find when I drink cold or eat anything cold, that it really affects my teeth.
They're starting to get a little sensitive?
Yeah.
Okay. Well, I'm going to have my assistant come in. We'll get a couple of photographs and I'll show you what's going on and we can kind of talk about that.
Okay, sounds good.
All right, thank you.
Thank you.
So, Amelia, remember we were talking a little bit about gum recession, and I said that yours had started to recede a bit.
Yes.
And you said you were noticing some sensitivity to cold. We're seeing that quite often these days, and I took a photograph so that we could talk about it and you could see exactly what I'm talking about.
Okay.
All right? So here's the photograph. These are your lower front 6 teeth. And you can kind of see how you have pretty white teeth up here.
Mm-hmm.
But if you look down here, you can see these yellowish areas.
Right.
That's actually the roots of your teeth.
Oh, wow.
Okay. And when the roots of the teeth become exposed in your mouth, that's when you start to get tooth sensitivity and they become hypersensitive to cold. Okay. So I wanted to explain a little bit about gums to you. You may have watched a recent episode on the doctors where they talked about a gum lift.
Right.
All right. And this is pretty much what they were talking about. So what's going on is there's basically 2 types of gum tissue. There's this type right here, and that is real firm, spongy gum tissue, and it's attached to bone, and it's designed to resist the forces of food as we're chewing and eating. Okay? Then there's another type of gum tissue, which is down here, and it's real loose and thin, and it's not designed to resist those forces. So what's happened around your front 6 teeth here is you've lost this attached gum tissue. It used to be here, and now it's down here. It used to be here, and now it's down here. And you can see, especially on this tooth, that it's getting really close to just being that loose gum tissue. Okay? Left untreated, this march continues, and the gum tissue will continue to recede down. Once it gets to this loose tissue, then we can expect that the whole root of that tooth would eventually become exposed and you would lose that tooth. You don't want that to happen.
No, that sounds really serious.
Yeah. So there's a relatively simple procedure to get this gum tissue back up here where it belongs.
Okay.
And that's where the term gum lift comes from. Instead of it being down here, we're going to lift it up and bring it up here and cover the roots of those teeth up again. Would that be something you'd be interested in?
Yeah, can you tell me a little bit about the procedure?
Yeah, with that procedure, it's now advanced to where it's a microsurgical procedure.
Okay.
There are a couple of small incisions that are made, and we make a little tunnel underneath, that loose tissue. We make a little tunnel there, and we loosen that gum tissue up, and then we can bring that up to the cover the roots up again.
Okay.
Suture it in place. Sometimes we'll put a graft underneath there to make it a little bit thicker to resist so that it won't happen again. It doesn't sound real good,
Right.
but it's really a minimally invasive procedure. Mild discomfort for about 24 hours. You will have some stitches for a week, but all in all, it's a pretty simple procedure, and it'll help you keep your teeth for a lifetime.
Does it take place in one setting? Do I come in and have it done and then come back in a week and have my stitches removed?
Exactly.
Okay. Awesome.
Yeah.
Sounds great.
All right. I think it would help you out.
Thank you.
Yeah, you have a beautiful smile.